just turn off your voicemail. And they'll never cancel because they can't cancel if there's no voice. They'll just no show. This is stupid advice. Don't do that. People will cancel. So learn how to fill those last minute cancellations. Like this is how we come back.
Learn how to move people up. I mean, I spent hours, before all this happened, not hours, but we get an opening and I'm like, all right, before we leave today, I don't care who works on it, but we are moving patients up. Well, and you get, I don't know if they want to. I don't care. Call them. They never know. You might have to call 20 people before you get one that fills it, or send out a text or an email or whatever case may be. But, if we're sitting around doing nothing, then we can't make money. You can't be productive, and expect to get paid for doing nothing. And I'm a worker bee. So I like to work and I don't like to sit and, okay, well, it's 2:00 here yet for the next patient,
I love same-day dentistry. I think and right now it's actually great because you're not wasting PPEs, you're not wasting time. If you have an opening, if you have time, and if you don't have time, sometimes you can make time. If you have a patient in hygiene and the patient needs something done, and it should be a whole team effort. It cannot be just the doctor doing this. If a hygienist is working on the patient, she sees that the patient had to have a filling done and they never finished. Look at the doc's schedule, see if they have time, and say, hey, while you're here, I noticed that there was this filling that we're supposed to do, and we never got around to it. Would you like to do it now if we can work you in? I mean, you're already here. And patients say yes all the time because they're literally already there. They might as well. And then you're not cleaning the chair again. You're not.
You mean while they're in the hygiene?
Yes.
That requires a couple things that hopefully people took advantage of while they were not seeing patient, is making every treatment look the same.
I love this. I cannot stand it's my room. Like every hygienist has a room and they have like a cat clock in it or something like that's like their thing. And this doesn't make sense. It's such an inefficient way of doing things. All of my rooms are the same. And we just moved to another room. And it's great for the hygienist too, because a lot of times, like if a hygienist is always worried about running behind, which I absolutely get. But in my office, that's not an issue because if you're running behind, the assistant will get your patient, put the patient in a chair, maybe take the x-rays for you. And it works. But when you start getting into like, oh, this is my room, then you shoot yourself in the foot because now you can't do same day dentistry because you got to move the patient. Now the hygienist is running behind, and like all of a sudden, something as simple as that becomes a barrier. So we don't have anything in the room besides like the general anesthetics, whatever, whatever supplies I use for every procedure. And every procedure is set up, every room is set up the same. We have a Cavitron in every single room.